Healthcare and senior care is fraught with problems and challenges, but we're also seeing some amazing new clinical treatments and resources. This show will help illuminate and uncover the good, bad, the ugly in order to equip patients, families, and other healthcare providers. Welcome to Senior Care Confidential.
Brian.
Joe.
The doctor is in.
I see this, yes.
We have a very special guest, a concierge physician, Dr. Hari Raja. We are so honored to have you here. And I just want to say, I met Dr. Raja for coffee a few weeks ago. And what I love about you is you are so easy to talk to. Like, why can't all doctors be this easy to talk to?
Because they live in such a fast-paced environment.
They do. And so we have got the key to success with doctors doing house calls. So Dr. Raja, just really quickly in a few sentences, tell us your bio. Tell us about your journey as a physician.
Yeah. So I'm originally from India. I lived there for about 7 years and then immigrated to the US, grew up in Houston, and then came to Dallas with my wife to go to medical school at UT Southwestern. Did my residency there in internal medicine at Parkland, and then stayed on as faculty for about 18 years, doing all kinds of things, academic stuff, teaching, and also seeing patients. And then I moved to Bumpsy downtown, the big Baylor downtown, for about 4 years up until the pandemic started. And then I went into concierge medicine with a group. And now I'm solo for the last 4 months. And it was a big change to go to concierge. But one of the main reasons I did it is the traditional system had become to a point where I wasn't satisfied with the care that I was giving my patients. And I had not realized that I was doing concierge all along for the last 20 something years. And so it was, that's kind of how my journey came to that concierge world, at least.
What do you feel like the negative impacts are in like the traditional sense? Like when you say the system doesn't feel like it supports this kind of level of care, what do you see like downstream for patients for that?
Yeah. So I started practicing medicine in 1998.
Okay.
So back then, managed care was just making a huge impact in Dallas, Fort Worth. Over these last almost 27, 30 years, what has happened is that there were a lot of solo practitioners or small group practices back then, and they kind of sold out to the bigger corporations with the hope that bargaining power and so on. Unfortunately, as managed care grew and so on, the patient panels that people had to follow were about 2,000 to 3,000 patients in primary care.
Per doctor,
correct.
Holy smokes.
And then the reimbursements have gone down and the expenses have continued to go up, of course, with inflation. So the only way you're going to make the same money to float your practice is to see more patients. And so what started off as 30-minute visits to an hour visits a long time ago, which is what I started with. I used to see a new patient for an hour, became 30 minutes for a new patient and 15 minutes for a follow-up patient. And now it's whittled down even more than that. And so with that many patients, a lot of patients can't even see their physician. They're seeing a mid-level like a nurse practitioner or PA because they just can't get in with 3,000 patients. So it's not so much that I think that doctors have failed the public. I think it's the medical practice system, the way it has evolved has become so challenging that it's just hard to take care of the people like we want to.
I got to imagine that it impacts the level of coordination or conversation, right? So from a relational standpoint with your physician, if you go from an hour to 15 minutes, like that is much more challenging. You don't feel like you get to know your patients, and vice versa, the patient gets to know the doctor. So that's on the relational side. But I can imagine you also see other effects, like if you're not with them for very long and you have so many other patients that you're having to see for the day, there's probably a few things that get missed too.
Yeah, there's a lot of things that get delegated to other people, such as giving back lab results or doing med refills without necessarily the reconciliation part.
Yeah.
And also people are seeing a lot of specialists and the communication pathway is kind of broken. So you don't know when a specialist has necessarily started a new medicine on your patient. They fax you the note, but you're getting many faxes a day. And so it just goes
you have
into
2,000 patients.
Correct. And then it goes into the EMR limbo, this And you might miss it, and it's not out of that you don't want to see them. It's just that it's just physically difficult to
Right.
see all the patients and to take care of all of this and catch the lab results and so on.
We see the med reconciliation thing all the time, like literally all the time. I'll walk in and we see what's clearly, I should say what's clearly, with a subjective history, you're realizing, okay, there's been a med change in the last couple weeks or whatever, but it's clearly been a drug toxicity. We've seen wild delirium issues. We've seen just hallucinations. We've seen mobility issues. We've seen patients where the daughters are concerned about now having to move to memory care, and all it was a drug issue.
Yes,
and so we see that and the specialist, the primary care doctor, wasn't aware that the specialist had ordered this other stuff, and so we see that regularly. That's a huge issue.
Yeah, and the visiting physicians, a lot of my clients love to have a visiting physician. So the services now through Medicare are visiting physicians, but it's actually visiting nurse practitioners. Well, where that is great, and it's wonderful that they can do those visits, and that really does keep the patient from having to go to the office. But how is that different with the concierge visiting physician? So just kind of share, you still bill Medicare?
Yes.
Okay.
Yeah, so concierge medicine is where the patient pays a fee, sort of like a subscription fee or a retainer fee, like lawyers and accountants charge, to be part of the practice. Now, in return for that, the number of patients that a physician usually has ranges anywhere from 250 to maybe 300, or some people will have more than that. It just depends on how big they want to go. I have fewer than 250. I have in the mid hundreds, so I have still lots of room. But the trade-off for that is that all the visits are 1 hour when we see the patients. And there's 24/7 communication where you can communicate with your doctor. It doesn't mean that they will be there answering a phone, because you have to set some sort of guidelines on how we use this. But you communicate with your doctor directly, and you don't see a nurse practitioner or PA. I'm not downplaying any of that. I'm just saying that you're getting that personal relationship.
You're getting access to the physician.
You're getting that ability to communicate with your physician in that. So about 2 years ago, I started doing house calls. I trained in house calls when I was at Parkland, but I never used it because it's just not economically feasible for most people to do house calls, because it takes a half an hour more to get to their place and then half an hour to come back.
Yep.
And then you're spending an hour there seeing them, so you could see another patient in that hour. So that's why a lot of people don't do this. But and the typical story is what happened to my patient, which is her spouse passed away. She sold her home and she moved into a senior community and said, I really can't drive to your office anymore. And I said, don't worry, I can see you at home. And she said, you do that? I said, yeah, I trained in this. And he said, you remember this guy named Marcus Welby? Yeah, that was me. I'm also doing that Marcus Welby thing. And so I didn't really know exactly what I was signing up for. I did my first house call and it was incredible. You get to see their home, which is really a huge thing, because one of the things that we're assessing for is fall risk in seniors, as you all know. And how can you assess that if you can't see their furniture or their kitchen or their closet or their bedroom or
this is what we always tell,
or how many steps there are when you walk in the house.
That's right.
Is it
the home environment is invisible to everybody else. Not there.
So that was one of the first things that I noticed was amazing. And the second thing was I had a conversation with my patient while sitting on their living room couch, talking to them. And so that was amazing. And also the children, whoever wanted to be there, was always invited to come to the visit so they can get that perspective and get their questions answered and so on. So I was hooked after my first couple of visits. It started with a couple of patients, and now I have about 45 of them, to 50 almost, that use the service. But it's a little bit more structured than just I see you at home when you need it. Because what we found, or what has been shown in the literature, is that the more often you see people, the more likely you are to prevent things, prevent hospitalizations, ER visits, and so on. So I actually see my patients every month, once a month, standard visit.
Yep.
Doesn't matter and they'll usually say, I don't think I need you to come. I'm healthy. I said, that's what you think. Well, we'll see. And then it becomes, after the third or fourth visit, really becomes more of a social, personal relationship where they know me very well. Yep. I know them very well. So I know when they call or when they contact me and say, I'm having this, I say, you had this about 2 months ago. Yeah. Let's just see how it goes. So I end up seeing most of these patients about 15 times a year, 15 visits a year.
Well, and you're with that regular visit though, like we could talk forever on this, but you're going to pick up nuances.
Oh, yes.
Just walking in.
Yeah.
You'll see something like, ooh, you don't look right today. Because I've known you once a month for the last several months.
Correct.
Something's off with you. Like, oh yeah, I just feel kind of down. You're like, nope, it's more than just feeling down today.
Yeah. I would, that's one, some of the amazing things that I've seen is like, usually I'll have one of the children send me a message. They're my spies.
Yeah.
So they'll send me a message saying that, dad's not doing, something's off.
Yeah.
And so I walk in and within 5 minutes, you can tell something's off because dad, who's usually very organized in the kitchen, everything is all in the right place. All of a sudden things are not.
That's
the coffee pot is not in the right place.
Yep.
And the furniture is not done the same way. It's a little messier, and that gives me a lot of insight. And their closet, the clothes are a little messier than usual. So you can really get a lot out of that as opposed to when they come see you in the office.
That's right.
First of all, they'll make any excuse not to come to the office. Traffic, weather, it's windy like it is today, all kinds of things. But I don't miss a visit usually from weather or things. Unless it's icy roads, then it's a problem.
That's awesome. Yeah.
So does concierge medicine at home eliminate the specialists? Because I know specialists, I have patients in their homes that do go see their concierge doctor, but they also have 3 or 4 specialists. And it's very frustrating for the family, and it's costly to get them to the doctor. So how do you handle that?
Yeah. So also back to your earlier question, we do bill insurance for the visits. We do bill insurance for the blood work. We bill insurance for the imaging. I actually can get their blood drawn at home. We have a third-party company that does that, and also imaging and EKGs and stuff you can do at home. So the need for a specialist really depends on why the person is going to the specialist. So if they have diabetes and they're seeing an endocrinologist once a year just to manage their diabetes, and they're doing great, then they probably don't need to see their endocrinologist. I can take over that function pretty well. But if they're seeing a cardiologist because they have a pacemaker and they get it checked once a year, or they have another device like a defibrillator and a pacemaker, and that gets checked, they probably still need to see their cardiologist once a year. But I can also fill in and manage some of the interim visits that maybe they don't have to go see. And I can communicate this with the specialist because that's what the other thing that I do is I do send my notes to the specialists, or vice versa. They send me their notes. And unlike in my previous practices where I was really busy, if someone has seen a specialist, I tell the patient, tell me when you've seen them and give them my information to send the note. Because if it doesn't come in the next couple of days, I'll have my staff contact their office and get the note so that I know and I can see. And after the first couple of times, the specialists know, and they usually send me their notes. So it works out really well. So it doesn't completely eliminate. There are certain specialties that they have to see, like ophthalmology for their eye doctor, dermatology possibly, definitely orthopedics, oncology. But it can reduce the number of visits that people have to do. And sometimes it can reduce the number of specialists that they have to see on a regular basis.
Absolutely. Wow. Yeah. So we know several concierge doctors here, but I don't know hardly any of them that do routinely house calls. And so that's been like it sounds like you've identified that as like certainly a gap where, okay, we've got house calls and we've got concierge, but there's not really a concierge that does house calls. And so in our world where we got, all of our patients are considered homebound, or they literally are, it's a very challenging to get them out for transfers, car transfers or whatever, to have the concierge, to have the access to, I don't want to say, I'll say 24/7 access. It may not be they're going to get a call at 2:12 in the morning, but 24/7 access to their physician who also does house calls, I think is a unique proposition here.
Yeah, it really is. Yeah. And I've learned so many things in the last 2.5 years of doing this. I've had patients where I would see them once a week if I had to keep them out of the hospital. Yeah. Which is never, that will never happen if they have to come to your office. It's just really, really hard for them to come once a week. But I made it so that, and it was a weekend visit too, because the children couldn't be there during the weekdays because they're working. Oh. So I went on Saturday. Every Saturday I went and saw them. It wasn't a long visit. It could have been half an hour to an hour. But that was what it took to prevent a very expensive hospitalization.
Correct.
Where anytime someone goes into the hospital, especially seniors, they lose a little piece of themselves in the hospitalization. It's just so chaotic in there, and it's just so difficult. And And also the doctors change every 4 to 5 days, and it gets very complicated. So I've been able to see amazing things like that, where just seeing them more often, I caught things much earlier before it became a sepsis or before it became an ICU admission, which is what usually happens in a lot of people. And I've also caught people who thought they had dementia, but they actually had depression or anxiety. And then but you spend the time so you can get to treat them, and they didn't have dementia. They got a lot better. And the family was super happy about that. Someone actually spent the time and talked to them and figured this out.
It's a much better diagnosis.
It's a lot better diagnosis. Yes, it really is, because you could do something about it.
That's right. Yeah.
And it's just, stories like that, things that I've seen. But I think keeping people out of the hospital is the biggest impact for sure that I've been able to see.
The Journal of Gerontology published a study. It's probably been 18 months ago. And they were, I'm going to butcher the stat, but it'll be in the ballpark. Something roughly like 65% of seniors who end up in hospitals, their baseline is significantly lower when they return home. And up to 50% of them, up to 50%, it's actually a prolonged or extended period of time where they are significantly at risk, and they've lost a lot of mobility. And one of the other interesting studies that I've seen too, it's on delirium, which we see in hospitals. All the time. And we can go through like a whole bunch of different reasons behind that. Some of it is actually the immobility that happens in a hospital, right? If you're not getting up and moving around, there's all these negative things that happen to the brain. And so they've done some interesting studies on that too. They say that 50% of the patients who are diagnosed with delirium in the hospital, 50% of them will actually have long-term cognitive impairment from something that's so... I shouldn't say so, because I make it sound so simple. In my world, it's very simple. I just wave a magic wand, and we don't have hospital-acquired immobility anymore. The reality is it doesn't, because there's committees that are there for fall prevention. The staff is understaffed in a lot of hospitals, and so they don't have enough people to come up there and make sure that we're mobilizing. But if half of your patients that end up in the hospital end up with delirium, and roughly half of them have long-term cognitive decline because of that, anything we can do to avoid some of that stuff is helpful.
And they did a study in California. It was a smaller study where they did give a concierge doctor who did house calls for 2 or 3 senior communities. And they followed these patients for about 15 months to 2 years.
Okay.
It was funded by, I think it was some grant from the local state government or something. I forgot what it was. And there was about a 70% reduction in ER visits and hospitalizations, and then readmissions to the hospital also. Because you can decrease that by if you see them. And I can tell you my experience, that is very spot on from what I've seen. Of course, my end is not 500 patients, but it only takes saving one life or preventing one hospitalization to make it worth it, I think.
Well, and just the wounds that pop up in the hospital. We have a patient with a nasty wound. They never caught it in the hospital. And so we're going every day, and the family's frustrated, because they're paying out of pocket, that it should have been prevented. So I love the concept of hospital at home. I think that's great. And I know that, they're trying it in certain hospitals. And yes, if somebody needs to be hospitalized, they need to be hospitalized. Absolutely. But I kind of see this too as it's the pre to the hospitalization. You're in there before, you're catching and checking all the dots and crossing the T's, and you're watching for these things that could lead to a hospitalization. And I love that, because you are keeping them out of the hospital. How do you feel about the hospital at home thing?
Well, having done this now for 2.5 years, although it feels longer because you just get lost in time, and you get a lot of referrals, word of mouth, really. The patients tell their friends and they say, is this real? I think there is some truth to that. There is, I've seen it, preventing hospitalizations, but also if you can think outside of the box and say, how can I get this patient taken care of without a hospitalization, but still providing some of that? So this is where home health agencies that do this are a huge part of this. Skilled nursing to come out and do things like that at home. think about what are you really accomplishing in a hospital. Really, if you need IV antibiotics, maybe you have to be in there.
Yep.
If you need
anything
ICU care,
urgent.
Urgent. So some of that obviously will go to the hospital.
Yep.
But things that are subacute, you might be able to do 2 or 3 steps before that hospitalization.
Correct.
And I've actually been able to do that also. With
Well,
my
and I
patients.
know as a nurse, if we call a doctor's office and the doctor's not available, you know what? Go ahead and call 911 or get your client to the ER. So that's just, it's almost in every home health you call, hospice, you rehab. If this is an emergency, call 911, So I love this, that this can prevent these sweet little seniors, they go to the ER now and they're in the halls, there are not enough rooms, and a lot of them really could be treated at home, with the right doctor.
Yeah. It is a last resort is what I tell them. I said, if I do my job and you do your job, then hopefully we can prevent any ER visits or hospitalizations. But things still happen.
They do.
You can't prevent everything.
Absolutely.
But you can certainly probably prevent more than not seeing you at all. Right. And what I tell them is they grew up in a time, and not all my patients are 80, 70-year-olds. I have 50-year-olds also who do this. They just don't want to come to the office and they live in their own home. And that's great. But there was a time when doctors came to people's homes to see them. There wasn't necessarily an office per se. So I joke with them and I say, instead of you coming to my office, I'm going to come to your office and see you there, because that's what it is, And I bring my stethoscope, I bring my blood pressure cuff. I can get blood work done a week before I see them. So I have all the lab results, and I print a copy of all this, and I write notes on there in English, not medical English, but your liver tests look good. I circle and I'm going to talk to you about this and so on. I give that copy to them. I said, this is your copy, so that you'll forget everything I told you. And you can then look at it 2 days later and say, this is what, he said, and so on. So it's basically delivering a new way of healthcare, going back to how things were, but using our technology that we have now.
Correct.
Because we didn't have mobile things back then. Now we do.
Right.
And we can really leverage that to provide almost everything you would do in an office. So it is really, really a nice complement to what I do, because I do have office patients too. And I do have these house calls patients. And most of them live in their own home. They're not living in a senior community, actually.
And they want to stay that way.
And they want to stay that. And that's the other thing I tell them is, if I can see whatever stage of life you're in, if I can implement this program and start seeing you more often, there's a higher likelihood I'll keep you in that stage here. And that's what that study also showed in California, that if you were in independent living, you had a higher chance of staying in independent living for longer. They only did it for 2 years, but they found that if you're already in assisted living, it's kind of hard to bring you back to independent living. But you can try to at least prevent them going to memory care. And
I think with a lot of seniors too, and their adult children, they're seeing the cost of moving to a community, the cost of having a caregiver, the cost of medication and supplies. And now we got to add on, Joe, the cost of a concierge doctor. But really, you're saving by working with a concierge doctor. And people don't see that. It's worth the investment,
Yeah, that study also showed that, because a hospitalization, even if you're just there for a couple of days, can be anywhere from $10,000 to $30,000 that's billed to Medicare or your insurance. And my cost is way lower than that. So,
correct.
So it is, as we say,
that pays for a few years.
It does pay, So it's sort of like an ounce of prevention is worth a pound of cure, the old saying that was there.
Yeah.
I've seen that in my own experience. And so I believe in it. I think that's why I still do it. And it does take a special kind of person to do this. You have to be very patient, and you have to really enjoy driving around the city and seeing your patients. But there's not a single patient that I have seen in the last 2 years where by the end of it, I say, I think this was really worth it. I really felt like I did what made me happy and what made the patient happy.
Yeah.
And that, at the end of the day, is why I went into this profession, was to get that happiness, to see somebody.
Yeah.
And I kind of lost that in the
you
old
hear
system.
that whole, like the bedside manner comment, about physicians. And I think a lot of it's because they have 2,000 patients
Yeah.
on their panel. It's like, I can't have, how do I deliver bedside manner in 10 minutes? Just that's tough.
It's hard by 4 p.m.
Yeah. Do not see me at 4:30 because I'm tired at that point. Yeah.
Yeah. So I try to have a smile on my face every time I see the patients. And I think what they also want that is really important is they just want someone to listen to who they are and what they want. And so I will tell them on the first visit, I said, my job is not to tell you what to do. My job is to figure out what makes you happy. What are your goals? It doesn't matter what I think. It really just matters what you think and what your family thinks, and make sure that, I'm aligned with what you want. Now, I will tell you and guide you in the right direction. I'm not just going to say, well, you've got diabetes, let's just not treat it.
Right.
So I will definitely, be the doctor when I need to be, but I'm going to be your advocate most importantly, and then your doctor second. And you
have time to find out what those patient aligned goals are, whereas you don't in a busier practice.
Well, when you see them 15 times a year, of course, you're going to get to know them really well. Yeah. So that's the average number of times I see most of my patients.
It's quite a bit.
Mm-hmm. Yeah. It is.
So how can the people listening, how can they get in touch with you?
Well, we can give them my contact information. It's VizeMD is the name of my practice, and I do have a website. It's vizemd.com. And what does that mean? Well, Wise is the New English version of that word, but the Old English version of Wise was spelled with a V. So it's Vize is wise. So I'm trying to tell you, I have 30 years of experience, so I'm a wise doctor.
You're a wise physician.
But I will listen to you and try to give you your best that I can, in that way. So then once my phone number is on there, my details are on there. I do have an office. It's in Irving, but I see patients on the Tarrant County side in Fort Worth, and I see patients on the Dallas County and Collin County. I'm actually on this part of town probably twice a week seeing patients. And I geographically map out my patients. I also make the next visit at the end of that visit. So we have it in the book so that I know, okay, I'm going to be in Plano at 1:00 that day. So I'll just see this person at 2:30. I always allow half an hour just in case, because you never know when there's traffic on LBJ or there's traffic on the tollway or whatnot. And I still get home by around 5:30 and it's a full day of work. Yeah. I think the most number of patients I've seen house calls in a day was 6.
Yeah.
So that was from about 8:30 till 5:30.
Yeah, that's about right.
Yeah.
Yeah.
But it was a lot of, it was busy, but a lot of good things happened that day.
Yeah, because doctors now, they say in order to make ends meet, they have to see 40 patients a day.
In primary care, internal medicine, probably somewhere around 15 to 20 a day to make it worth it. And I don't have to see 15 to 20. Yeah. Obviously I can, because you're spending an hour with each one.
Yeah.
So I see about 6 to 7 is sort of my maximum in a day.
Yep.
But the average is around 3 to 4 in that range.
Well, we have loved having you, and I really encourage people to get to know you. If they just want an interview, just to talk on the phone, they can do that as well. And they just go to your website.
They can. They do not. There is no obligation for me to talk to you. I actually talk to every person and tell them about everything I just said today about what the practice is and what my philosophy is and so on. It's kind of like a meet and greet where there's no obligation to sign up or anything. They can get the information. And I tell them, it takes about 3 visits to get to know somebody. And this is not like a year-long contract. It's not like you can't break anything. Yeah. It's really just, it's very reasonable. And then if I don't do my job, you tell me what I do wrong and I will fix that and make it worth it. So.
Yeah, that's awesome.
Thank you so much.
Thank you for coming.
Yes, I wish you the best because I love this service and I will highly recommend to my clients as a care manager.
Yep. Likewise. Yeah.
Well, thank you so much for having me and hearing about what I do.
Thank you.
Great.